Welcome to Pain Clinic, and the reason that you're here is because you have probably got back pain and persistent back pain, and if that's the case, it's more than likely that you have been given the diagnosis of non-specific back pain. And even in 2021, which we are now, with all the resources and everything that we've thrown out to try and identify the cause of back pain, which is the leading cause of disability and missed days off work in the world, we still end up at this place of a non-specific cause of our back pain, which can be frustrating. And that's really what Pain Clinic and this project is about, to try and make that a strength and make sense to get you to the point where you can self-manage, okay? We know that less than 1% of back pain has a serious cause, and that is fracture, cancer, infection, and hopefully you've been to your GP or you've seen a clinician to be able to get those things ruled out. Then the next 5% of back pain is going to be what we call nerve root, which is that it is caused by an injury or irritation to your nerve root, which would be maybe more classically known as your sciatica. And that leaves the other 90 to 95%, which is in the non-specific, which means that we can't say for sure what tissue, whether it's muscle, ligament, cartilage, bone, is the cause of our pain. And that's led to a lot of difficulty in how we've managed back pain, and it's led to reductionism being one of the main problems. And what I mean by reductionism is that if we take a machine that's broken, okay, something like a clock, it's not working, and we take it apart to try and find all the different pieces that make up the clock, your hands, cogs, batteries, whatever it may be, we can find the piece that is not working or broken and is why the clock isn't working. We can replace that and then put it all back together and the clock will work. Okay, reductionism makes sense in a mechanistic system like a clock. But if we take something else that's broken and take a cloud is not raining. I'm from Wales, so it's not very often the clouds are not broken there. But if we took the same reductionist approach to try and find the piece of the cloud by breaking it in half again, breaking it in half again and again, until we've got thousands of pieces of cloud to try and find the piece of the cloud that would explain why it's not raining, and then put the cloud back together, you hopefully come into your own conclusions there that wouldn't work. That's going to be dependent on far more factors like the environment, how high the cloud is, and ultimately what we're getting at there is that clouds are a complex system. Humans, myself, you, are much more like clouds than clocks. And the really unfortunate thing that people with persistent aches and pains, particularly back pain, is that they've been treated like a clock. You've presented with back pain and someone has then maybe scanned you, and maybe we've then even had surgery to try and find the piece that's causing your back pain, put you back together, and then we're really scratching our heads as to why we have such high rates of failed surgery for back pain. It's because it is a complex problem. It is a multifaceted experience, and that is what that's going to set Pain Clinic apart in this process over the next 12 weeks, where you're going to be working through a biopsychosocial approach, which means that we're going to be looking at the body, there's going to be movement, there's going to be psychological and social interventions, which is going to be really trying to hit this, what we call contemporary approach, evidence-based approach, to be able to get you to the point where you're doing the things that are really important to you. My name's Luke, and I'm a chiropractor, and I run a company called Back to Roots. You'll also have a big component of Paul McCambridge, who's a big part of setting up Pain Clinic to deliver these interventions. He's also part of Back to Roots, and we run a healthcare company to help people just like you to be able to achieve the things that you need to be able to do, to be able to hopefully get pain-free, but if you can't get pain-free, to be able to get to the things that are important to you to be able to do. We're going to be looking at being able to put that project together. We run these approaches with our patients in person. We also run the Academic Institute in the University of South Wales, where we teach the healthcare professionals to be able to work in the way that you're going to be going through in this pain clinic. And we are also British Journal of Sports Medicine certified, which to this day in 2021, we're currently the only chiropractors, at least, that can say that. You're not going to just have exposures to chiropractors in this program. It's going to be multifaceted to be able to use different healthcare professionals to help you along the way. Now, the first concept that I'm going to be delving into, because in each section, you're going to have a slightly deeper component to be able to get a cup of tea out and listen to the things that I'm going to be going in to make these things make sense, and then to actually impact the things that we're saying into your daily life. There's going to be a workbook that you're going to be working through that has these in, as well as other education and other things for you to be able to read, but ultimately you have to be actioning them, and that's going to be super important. Now, a term that's going to be coming up over and over is going to be this idea that we have a sensitized alarm system. That is a metaphor of an alarm system that I want to be able to put a little bit of meat on to be able to make sure that this makes sense, because until it does, the interventions are going to seem disjointed. Now, if I was to ask you if you stepped on a rusted nail, would you want to know about it? Would you want to have a system that's going to tell you about that? And hopefully you would be looking at that and saying, well, a rusted nail, maybe, what's going to be the impact of that? Potentially, it might hurt, We'll talk about some situations where it might not, but the impact of stepping on a rusted nail could be that we may get infection. So we need to have a system that's going to be able to tell us of threats and such things, to be able to warn us, and that is exactly what our nervous system is designed to do. This isn't to scale, and maybe you can't see it very clearly there, but this is just illustrating that our nervous system is for over 400 miles running around our entire body, from our feet all the way through to our brain at the top. That is buzzing around, and you may have heard that it is electrical impulses that our nervous system operates by. All about this idea of protection. And what happens in that moment when you step on that rusted nail is that something happens in the receptors or in the nerves in your feet. They trigger off an electrical impulse that then sends information into your spinal cord, up to your brain, to be able to grab your attention and then do something about it. As we work through this program, you're going to appreciate and learn some really interesting concepts, and that includes that pain is an output, not an input. At this point, we have danger messages coming in from where the threat is. In this case, it's a rusted nail. Now, what should happen in the vast majority of cases is that we take our foot off the rusted nail, we rest, and we let the body do its healing. We limp around, we heal, we let things calm down, we let things heal up, scar, remodel, and then as we go through those tissue healing times, the pain should ease off and we can gradually get going again. And you'll know people that that's been the case with their aches and pains, that as their injury settles down, they can then get going, gradually doing a little bit more. Now, 1 in 4 people, for some reason, that alarm system never quite comes all the way back down to its starting resting position. And it's this concept that really is how we communicate or try to understand this idea that we have a sensitized alarm system, a sensitized nervous system that is closer to the point where it's going to set off the information into our brain to tell us to do something about it. And what you'll also be able to appreciate is if we can see this idea that the alarm system has stayed closer to the point where it's going to be set off, then you'll be able to remember things that you used to be able to do before you first had pain, before you had your injury, that you can currently do less of before you set off your alarm system. As part of the tasks from this session, in this week of your education, will be to identify what those activities are, because they're going to become incredibly important and motivating, because they're going to be the things that we're going to be looking to reel back in to get you back to being able to do. Okay? You're going to jot this down in your journal that is going to be alongside the support workbook, and those things could be bending down to pick up a grandkid. They could be getting back to being able to play rugby. They could be being able to walk further to work. Those goals have to be meaningful to you, but if you spend a little bit of time with a cup of tea, you will be able to think of some things that you currently can't do because of the pain that you're experiencing in your back. And this is going to be the first step of you being able to action that. Now, the metaphor that I've already mentioned a couple of times is that our nervous system is like an alarm system. We have an alarm on this building here. You have an alarm on your car. What is that alarm designed to tell us about? It's designed to tell us about someone breaking in, a fire, a threat. And that's exactly what our nervous system is trying to do the whole time. And an example that we use is to be able to say the old cars in the 80s where the wind would set off the alarm in the car. Okay, it's going off not because somebody's breaking in, but because the alarm system itself has become what needs to be worked on and what maybe needs to be altered. And that's where we're going to be introducing that first metaphor from this session and working through is this idea that we have a sensitized alarm system and we're going to be trying to desensitize it with a biopsychosocial approach, treating you like a cloud, not a clock, and to get you to the point where you can do those things again. Now, what you will also say, hopefully at this point is, you know, I know other people who have had back pain and it's just settled down like you sort of talked about before. Why has my alarm system stayed sensitized? And that is going to be really individual to you. And that's where we start being able to delve into the different things that we may have experienced up to this point. Some people, you may have seen a chiropractor who's told you that your back pain is because of your posture. You may have seen a physio who's told you it's because of your core strength. You may have seen a doctor that's told you it's because of stress. You may have seen an acupuncturist that's told you that's because your chi is off. These different explanations ultimately lead us to be confused. You know, what's causing my back pain? Why isn't someone able to find the thing? Alarm system requirement for protection or safety. Probably going to sensitize because it's a threat. I don't know what's going on. You know, just having pain in of itself. That is something that our nervous system is going to become better at doing. Some people, you may have job issues. You may have some issues going on with your boss at work. You may hate your job. You may not have a job. These are going to be factors, and the very fact that you're in this program means you may have failed things in the past. You may have failed physiotherapy. You may think exercise rehabilitation doesn't work and it's not for me. Now, these may be relevant to you, the examples that I've just gone through, but what I would like you to do in the second task in your workbook for this week is to be able to have a little think around different stuff that you may have going on that could be contributing as to why your alarm system may be sensitized. It will connect to different tasks through this program as we work through, but I want right from the start to be able to get us to start looking at a multifaceted approach because it is going to be important. We know that the more you know about pain, the less you will experience pain. Understanding is an analgesic, and that is going to be your tasks in the workbook this week.